ramble for a little bit about that post of mine while I'm getting ready to go to work. So let's talk about like a little bit of the science behind that anticipatory muscle function of the TA and the pelvic floor. So what I mean by anticipatory is that these muscles, so your stabilizers of your spine, your pelvic floor, your transverse abdominis, that deep core muscle, they know ahead of time that you're planning to move your body in a certain way, and they contract to stabilize you. So let's just, for example, like I'm going to reach over and grab something from over there. I reach. If this side of my body, pelvic floor, abs didn't contract, I literally fall over, right? But I didn't have to think, I'm going to reach over there, so I better turn on my TA and lumbar stabilizers and all that good stuff back there to counteract the motion. It just does it for me. So that's great. Our body does it for us. Awesome. Okay. However, when we have an injury, so that could be a pregnancy, that could be, an injury to the lumbar spine, it could be hip pain, whatever it is, sometimes that anticipatory feature shuts off as kind of like a protective mechanism. It's weird. It's, there's more that goes into it. However, that's important for those of us who've had babies, because if we are going and moving and doing something, picking up the baby or whatever it may be, and our pelvic floor and TA aren't coming along for the ride, what does that mean? More pressure on the organs, right? Maybe we're gripping more with the upper abdominals, the obliques instead, stuff like that. Thankfully, because this is a reflex, we can change it and train it. So our nervous systems are not stuck and still, and they can be changed and manipulated, which is fantastic. So the way that you change and reestablish this anticipatory feature is by engaging those muscles in the way that they're supposed to behave before you do an activity. So for someone who's early postpartum, that might look like exhaling and doing a pelvic floor contraction before you stand up out of the chair after nursing your baby. For someone with a toddler, this might be, or even a baby, whatever, getting them out of the bathtub. So you're in a lunge or a squat and you lean forward. Exhale, engage the abs a bit, engage the pelvic floor, and lift. Great. So those are some examples. You guys are kind of getting the picture. So for my postpartum patients, or someone who I'm just noticing that feature isn't present, so with my patients who need to retrain this, I teach them how to do a proper pelvic floor contraction, how to do a proper transverse abdominis contraction, and then we practice various positions and various movements, doing a little bit of a contraction before a movement. And then we also talk about, of course, grading it. And so this is the point of my post, is that when you stand up out of a chair, you should not need to engage your pelvic floor 100%. That task does not demand 100% of your effort. Maybe it's 5%, maybe it's 20%. Regardless, it doesn't need to be 100%. If you were to consistently engage your pelvic floor muscles 100% of the time for all of these movements, what's going to happen? You're going to become hypertonic. You're going to start gripping and clenching, and we all know that that can contribute to worsening pelvic floor and prolapse symptoms. I'll give some examples of myself. My pelvic floor tends to be reflexively, work pretty well. Early postpartum, not so much, but once I trained it, cool. My abs, on the other hand, struggle. And I think that's just my long history of back pain. So I have, for those of you who are new, I have a leg length discrepancy and scoliosis, and so my abs don't coordinate quite as well. Pelvic floor tends to be okay. So if I'm picking up my son who's 30 pounds or, moving around my patients during the day, their limbs, whatever, I don't think about my abs or my pelvic floor because I've trained them to do what I need them to do in those moments. And I don't need to do that anymore. Today I just did some deadlifting for my workout at my probably 70% of my max right now. I did engage my TA first. I did lats, TA, a little bit of pelvic floor as I exhaled.